Hi, I'm Dr. Sage Wheeler at Sage Med in Bellevue, Washington. Today we're going to be showing you a new type of hormone therapy called BioTE Pellet therapy. This is for treatment of menopausal symptoms, andropause, which is like menopause but for guys, and as well as some chronic pain, chronic depression, and chronic fatigue symptoms. If you'd like to know more about BioTE and sagemed.co, check out the link in our bio. Now today we're going to do a pellet on a female. So you're going to get to see what it looks like and how quick and easy it is to do. We're going to head on over to the exam room and we're going to walk you through the entire thing. Okay, now we have the patient draped and ready to disinfect the skin and anesthetize the area. We use the same kind of numbing agent that your dentist will use to completely numb the region, so patients don't feel anything other than just a little bit of pressure. This is just a little chlorhexidine. It kills the bacteria and makes this very sterile after a good 30-second scrub. The rate of infection with BioTE pellet therapy is very low, less than 1%. And if infection does happen, it's usually very easily treated with a little shot of antibiotic that goes right next to the pellet. But of course, anytime we're doing procedures on the skin and inside the skin, we want to take the utmost precautions to keep bacteria out of the area. And so next we're going to put in the anesthetic. And this is probably the only thing that people really say they feel from the treatment is that quick little pinch right there. And then we just slowly inject this spot. We want to get it nice and numb. And there's a little bit of epinephrine in here as well, which really helps to control any bleeding during the procedure. So that's all there is to it. Quick little 30 seconds to numb it up. It takes about 2 minutes for the area to go completely numb, so we're going to pause the video and we'll be right back with starting the procedure. Okay, so we've just finished up the initial incision here. You can see it's a very small wound, just enough to get this trocar through. This is a stainless steel trocar that the pellet goes through. And we just kind of twist it into the skin. It goes comfortably into the fat layer. The fat here is very soft, so there's minimal resistance as it goes through. And you can see the patient didn't even flinch. Very comfortable procedure once you're all numbed up. You can see there's a very small amount of blood, which is normal just for a skin procedure. This is what the pellet looks like. This is a sterile pellet that contains pure USP testosterone. Once we put the pellet in the chamber, we load it in here, a little push rod, and it just goes click and goes right into place. Okay. So at this point, we're just finishing applying the tincture of benzoin, which is a glue that helps the steri-strips to stay into place. These are just very firm Band-Aids, basically, that help the wound stay closed. So all we do here is stick that, give it a little squeeze to keep the wound closed, press it tightly. Dab just a little bit of that blood, the sterile gauze. Make sure that wound looks like it's the edges are nice and close together. People always wonder, if I get several of these procedures 2 or 3 times a year, am I going to have scars all across my backside? Pretty much, because it is such a very small incision and it's made with a surgical scalpel, the wound heals almost invisibly for most people unless you're prone to keloid scars. And by the time you get to your second or third pellet, the scar from the first pellet is largely resolved and kind of just blends into the rest of the skin. We make them up here in this part of the buttocks area because this is usually where people's underwear will cover their skin or their swimming suit. So even if it does leave a small scar, it's not visible. All right, so all we have left to do is make a little Band-Aid. We're going to cover this with some Tegaderm, which is a nice sticky film that helps to keep the area clean and dry. There. And this is how we leave it covered for 3 days. We ask patients not to get the area wet for 24 hours and not to soak in a pool or a hot tub for 3 days. And that is all there is to it. You just can cover that up with the pants and you go right back to work. There's no downtime. And typically you'll feel the effects of the hormones kick in about 2 to 3 days, and they'll last for anywhere from 3 to 6 months depending on your activity level. So that is how you do the BioTE pellet procedure for females. And if you're interested in learning more about BioTE, what it can do for your quality of life, you can contact us here at sagemed.co.